Hello, my name is Eric Coulter. I'm going to be the instructor this semester, and I'm really excited about this for the online version of financial management and public health. And H619, I believe, is the correct number that we're going to have for this class. And what I wanted to do with this is just do kind of an introduction. I understand that many of you are MPH students, and you're taking this course to get more of exposure to the financial parts of public health, which are very important because without money you can't do anything. So what I want to do now is just kind of do a quick introduction and then talk about some of the things I'm going to kind of address throughout the semester. And just first of all, my educational background is a little schizophrenic. I started out as a social worker, so sort of in a bachelor's in social work, sort of in the people field. Worked in that field in mental health and in general health for 10 years. I also during that time became a medical services officer in the National Guard, but trained at Fort Sam Houston in San Antonio, Texas. They trained most of the medical services officers, and so got that experience. During that period of time, I also started, my bachelor's was from Ball State. I drove back and forth to Butler University and worked on an MBA. Had to go back to IU East in Richmond and get a lot of the basic financial courses to do that. But the MBA, I completed that after a few years of driving back and forth, and be thankful you had this online option. It makes things a lot easier these days. But I was able to spend time, learn a lot about the finances, and kind of help me with an area at that time I didn't have a lot of experience or strength in. And then later on, as time went on, I went back to Ball State and I got a doctorate's degree in adult, higher, and community education. I've taught for IU East, I've taught for 15 years, and for Purdue off and on university locally in Richmond, Indiana, and then I taught for IU School of Public Health Bloomington in their MPH program, basically the same course that we're going to be doing this semester. I taught for them online. And so I'm looking forward to it. That's my background, kind of the people skills, soft side, but then also I've had experience in the financial side, and I've had a lot of years of teaching, and I really enjoy it, but kind of focus more on the work experience. As I said, I started out as a social worker, and then at Richmond State Hospital and at Reed Health in Richmond, Indiana, both in Richmond, and then went on after I got my MBA, I started at the Wayne County Health Department in Richmond, Indiana, and have been the executive director there since 1991. Throughout that time, our health center began to grow. We were a state-funded health center, and we still are, but we became more and more of a health center, hired physicians, had a pretty large client base, and so I've had the public health experience and also the health center experience throughout my tenure here. We've always grown and brought in more grants, brought in more revenue, and done innovative things. For example, the television. We were a pioneer and a leader in the television area, doing a lot of public health media. We've worked with a lot of people, and Surgeon General Dr. Satcher, David Satcher used to be the Surgeon General. We've worked with a lot of our Congress people. So we've had a lot of experience and exposure in that. And then throughout time in the financial area, we began to grow and grow. And we currently have about 12,000 medical patients in our community that work with us. And I always say that with Butler, if all our patients showed up on the same day, they wouldn't be able to fit into Hinkle Fieldhouse because of the numbers. There's so many of them. So people in our community depend on us. We have 3 full-time physicians and 2 full-time mid-levels, which is a physician assistant to provide primary care. As we were going through this process, money became more of an issue and the financial ramifications, so we became what they call rural health certified, and that's a way to get enhanced Medicaid and Medicare. So we went through that, did that in 2010, we completed that process. And then as time went on, we started researching the idea of becoming a federally qualified health center. And so that requires you, in our case, we're a public entity model. We're still part of the county, we're still part of public health, but you have to create a separate governing board that works in collaboration with the county health board. So we have a county health board and we have a governing body, and that governing body has to include some members of the, at least 51% have to be clients. And then they sign a co-applicant agreement and work to supervise the health center. What that allowed us to do is to enhance our Medicaid and Medicare third-party reimbursement even more. And then it also opened us up for significant federal grants, which we've been the recipients of. We've now started a dental clinic. We're working to hire a dentist. So it's allowed us to do much, much more in behavioral health to reach out to our clients. I have thought that the financial part isn't always the funnest part of what I do, but it's an essential part. You have to have money to help people and to do things. And so having an understanding of that is very important. As I said, I'm looking forward to teaching this class. I think you have to have an understanding of the basics, but I'm going to try to offer this class in a way that you get the practical, hands-on things. You're not going to become a CPA by taking this course, but I hope you have exposure to some of the financial information, the processing, how to deal with third-party billing, how to set up budgets, how to work with the stakeholders. But I'm going to try to keep it level. Some of the materials in the book at times will become complicated financially, but we will be able to work through this. You're not going to get your CPA necessarily at the end of completing this course, but I think you will learn about many of the high points, how to leverage funding, how to pursue funding, how to understand funding. I think that's going to be one of the most important parts of what I hope to accomplish with you. What I hope, the class is going to be broken up into separate modules, and I hope to use this mechanism to communicate with you throughout this. I'm doing this as sort of an introductory video of who I am, and what I hope to accomplish with you as we work through the course. And then I will come back at each module and kind of like focus on certain areas that we're going to try to work through during that module. So my name's Eric Coulter. I'm a pretty down-to-earth person, looking forward to this. Like many of you, I spent many years going to school and sacrificing, so I understand your time is important, and I'm excited and look forward to teaching the course. Thank you.